Good morning, everybody. I appreciate everyone hopping back onto our webinar this morning and joining us for our Prestige webinar series. My name is Jason Flynn. I am the Director of Human Resources and Client Services for PrestigePEO. For this morning's webinar, we'd like to introduce our other presenters. We have none other than Carol Sawyer, who is our tax manager, and I'm sure many here are familiar with, so welcome back, Carol. And we have a first-time presenter here in Teresa McLaughlin, which is our Director of Benefits here at PrestigePEO. So I'm happy to have everyone here presenting with us. As for today's agenda, we thought it'd be a good idea to discuss some important information as it pertains to the end of the year and deadlines that are coming up fast and furiously. And I'm sure everybody is looking forward to the end of 2020, putting that behind us, moving on to what we all hope is going to be a much more prosperous and better year in 2021. Now, Carol is going to take everyone through the approaching deadlines as it pertains to the FFCRA and the CARES Act and what that means for the end of the year and the approaching deadlines that are applicable to it. She will also discuss the IRS limits for 2021, and that's in regard to reimbursement accounts. Kathleen was supposed to be on this webinar, who we're all familiar with, but Teresa will be taking over, and she will be talking about the employee benefit side. She's going to provide some tips for maximizing your year-end benefits and then talk about some exciting vaccine updates. Carol will then hop on, and she's going to discuss the payroll year-end guide. And with that, that's going to include such information such as W-2s, year-end bonuses, payroll adjustments, fringe benefits, things of that nature. Then I will hop on and wrap things up with some compliance reminders as it pertains to stay-at-home orders, sexual harassment training, paid sick leave. Again, we want to really focus on the end of the year, how to prepare everybody for it, how to answer some of those questions, and that's going to be our focus this morning. So just as a quick reminder, all participants will be muted throughout the webinar. However, we do want to get to your questions. And if you do have any questions, please, I urge you to use the Q&A feature within the webinar so that our panelists and presenters can sit there and help answer those questions actively as we are going through the webinar itself. And of course, if we don't get to something or we don't have an answer right away, we will certainly get back to you directly after the webinar. But yes, we will do our best to answer all incoming questions. A copy of the presentation will be available on the resources section of the Prestige website following the webinar, and we will also have a recording of this webinar on the website as well. So, with that being said, what I'd like to do now is pass things over to Carol, and she's going to take it away.
All right. Good morning, Jason. You can hear me okay, correct?
Can hear you loud and clear. Thanks, Carol.
All right, thank you. Okay, so both pieces of legislation that were passed at the beginning of the pandemic all do expire at the end of 2020. So the first one that I want to mention is the FFCRA, or the Family First Coronavirus Relief Act, that was set up immediately in March as soon as the pandemic started. The federal government wanted to offer a way for businesses to pay employees that were affected by the virus, whether they had a sick pay policy in place at their company, and then also reimburse for the expense of paying those people. So there was an emergency paid sick leave, and there was an emergency family medical leave that had a dollar-for-dollar tax credit that went along with it. And actually, the way FFCRA was written, you were mandated, if you had less than 500 employees, that you had to pay individuals that were affected. But this expires at the end of 2020. It expires on December 31st. In all of the talks in the possible next stimulus package, I have not heard this mentioned, which is unfortunate because this is a way to help people stay home should they feel sick and not know if they have come down with the virus, and therefore prevent further spread. So that tax credit and that requirement that you have to pay people out with the virus or once again, that medical leave part that was also if they were caring for someone that was sick or a child was out of school or you couldn't find daycare, those tax credits and the requirement to pay do expire at the end of 2020. Many of the states that our clients are in have a paid family leave law in place. I know New York does. Massachusetts, you can start making claims in January of 2021. Connecticut is just starting it. Claims won't start for another year, but there are some safety nets in place for people impacted by the virus to get paid. Next slide. All right, then the CARES Act. Those provisions also all expire at the end of this year. One of the biggest things in the CARES Act was the FICA deferral, where the employer was able to defer the payment of their matching 6.2% FICA tax. The deferral does end at the end of 2020. The repayment plan is you have to pay 50% by the end of 2021 and the other 50% by the end of 2022. I will mention, we did learn after the development of these slides, is the IRS is starting to put out information for those businesses that feel comfortable paying some of that money back. It is going to be a direct transaction as of right now between the business and the IRS. We have not set up any process for a third-party payroll provider or a PEO to collect and submit those funds. Businesses will need to set up their own EFTPS account, which is the electronic fund transfer program for the government to repay those taxes. But I'm sure there will be more information on that as we move into 2021. And then the next slide talks about the other smaller provisions within the CARES Act, the unemployment benefits for the self-employed independent contractors, people who have never really been able to collect unemployment before. Their ability to collect those benefits ends. The extension of unemployment benefits from 26 weeks to 39 weeks also ends. So you will have a great many people, unfortunately, no longer eligible for unemployment at the end of this year. And the last big item that was in it was the student loan forbearance. There was no interest, there was no payments due. That originally expired in September. President Trump did an executive order to extend it to the end of the year. Betsy DeVos has now extended it one more month. I think there's hope that the next stimulus package will include a continuation of the forbearance on federal student loans, since we had a great number of kids graduate college in 2020 with no place to go. So those are the major items in the legislation that are expiring at the end of the year. We are actively watching what's happening in Washington, and should there be another stimulus package, we will be back on a Wednesday to fill you in on all the details in that. And Jason, that brings me to the end of my information. I believe Teresa will be taking care of the reimbursement account.
Thank you, Carol. Thank you, Carol. I appreciate you hopping on and talking about that information with everybody here today. At this point, I'd love to introduce our Director of Benefits, Teresa McLaughlin, to go through some employee benefits information. Teresa? Teresa, are you there? All right, Teresa seems to be having some technical difficulties on that side. So I'm going to take back control, and I'm going to do my best to fill in Teresa's shoes as we take you through some of this information here. So again, just a lot of information that we want to relay to everybody as it pertains to the information going into 2021. So as you can see here, the FSA, the Flexible Spending Account, the limit will be $2,750 over the course of the year. And then as we move down to the dependent care, which we see as the steady $5,000 per year. Moving down to the health savings account and providing those numbers to everybody here, we have the health savings account. So for the individuals, the limit is going to be $3,600 for family. It's going to be $7,200, and then for people that are 55 plus in age, there will be an additional $1,000 allowed to those people. So that's what we're looking at for 2021 as we move into that new year. Moving over to the commuter benefit side, this is something that obviously now, 2020 commuter benefits is something that, was probably put on pause a little bit. This is a great benefit that a lot of people that use mass transit are able to benefit from. Naturally, this year with so much remote work, it might not be used as much. But again, getting into 2021, we're hoping that it brings a better idea, a more sense of normalcy so that we can get back to using these benefits as we get back into the office. So for commuter benefits with the transit passes and the van pool services, the allowable limit is going to be $270 per month. And then, of course, you also have parking. As you know, commuter benefits is separated into transit and then parking. So for qualified parking, you do have also a $270 per month limit that you can use. And again, this is fantastic, especially when it pertains to COVID-19 relief. The IRS has approved the transfer of monies from the mass transit to parking as long as both are offered. So it's important to note that change as it pertains to the COVID-19 relief. Now, we want to talk just a couple of minutes about some tips for maximizing the end-of-year benefits as it pertains to employee benefits, right? So the deductibles, it's important to note that the deductibles do reset on January 1st. And with that, keeping that in mind, you want to be able to understand how to maximize the savings opportunity when as it pertains to the deductibles, right? So for those who do meet their deductible or almost meet their deductible, you want to consider exhausting that before January 1st, right? You want to take advantage of those deductibles. So things that we're talking about, lamps, prescription refills, testings, you want these things to be covered in full. And if you are almost there, you want to consider exhausting that before January 1st. For those that are not close to meeting their deductible, you really want to think about delaying any of those healthcare expenses until after January 1st, if it is all possible. Again, I don't want to urge anybody to not seek medical attention. If it's necessary, absolutely go do it. But if you are in a position where you can delay it to take advantage of those healthcare expenses, then you might want to think about waiting until after January 1st. For those who have a flexible spending account, you want to remember that the IRS does allow a maximum of $550 to be rolled over into the new year. Any money over that is any money over the $550 will be forfeited. So it's important to check the list of qualified expenses and purchase what you would need to do to exhaust any of those available funds, at least above and beyond the $550, because you can carry that over, and the IRS does not allow refunds. So we want to make sure at the end of the year that everybody understands and remembers to check on that. I've definitely been in that situation where you're getting down to November, December, and you're like, let me check that FSA because I don't want to lose that money, and we don't want you to lose that money. It's there for a reason. So remember to check that out. And also with the health savings account, your HSA. The funds in these accounts belong to the owner of the account, and they do roll over year after year. So the funds will also transfer to the owner of the account if there is a change in the job. So it works a little bit differently than the FSA does. But again, it is something that you do want to keep an eye on as they are your funds. So looking ahead to 2021, as it pertains to the COVID vaccine, right? This is something that we've been talking about for a long time. We've all been looking forward to it. I know that everyone has probably been seeing it in the news, and these are conversations that are positive ones. We're moving in the right direction. So we wanted to just give a quick update, and please understand that obviously, you know, as with everything else in 2020, everything is up to change. Everything is in flux. The idea here is to just provide to you what we know based on what we get from insurance providers and the contacts that we have within the industry, so that we can give everyone here a sense of calm, a sense of normalcy as we move into the new year. So as you're all aware, I know the vaccines to really combat the COVID-19 coronavirus pandemic are due to roll out in the U.S. shortly. It is anticipated that all adults will have the ability to get the vaccine in 2021. You know, planning the distribution, receiving, storing, handling vaccines is definitely under scrutiny of the federal government and the CDC, as you know, as it should be. We want to make sure that we're doing the right things and we're doing it in the right way. Pfizer and Moderna are seeking emergency authorization, which is expected at any moment. However, both labs are underway with producing millions of vaccines for distribution. It's also important to note, you know, we've had conversations internally, and you know, I'm sure as I move on to the next slide, I'm sure people on this call have also gotten those text messages, whether it's from a pharmacy or Northwell Health or different areas, you know, talking about vaccines. We're going to get the vaccines. And typically what we're seeing is that they're urging people, I think they're designed and urging people to not slam doctors with calls about this. I think that it appears that they want to communicate this the right way. So that's what we're seeing here. These vaccines will be at no cost to members, regardless of the type of health plan. You know, so meaning that group plans, individual plans, Medicare, Medicaid, fully insured, and self-insured. They are partnering with grocery stores, pharmacies, chains such as CVS. They are expected to get the vaccines distributed as quickly as possible. Pardon me. So beyond that, you know, one news alert we wanted to bring out to everybody is that Governor Cuomo did just announce that New York will receive its first doses of the Pfizer vaccine by December 15th, which is just a short 6 days away. Additional doses will follow by the end of the year. The governor has also put together a clinical advisory task force consisting of healthcare professionals and scientists to review every vaccine authorized by the government. So that is the quick information that we have as it pertains to the COVID vaccine. You know, I'm sorry that we weren't able to get Teresa on the line. I'm sure she'll join us for a future webinar. But before I get into my compliance reminders as it pertains to the end of the year, I did want to invite Carol back on so that she could talk about the payroll year-end guide and how it pertains to everyone on this call.
All right. Thank you very much, Jason. Okay, so W-2s. I need to remind all of our clients that all payroll items that are to be included in 2020 have to be submitted to Prestige no later than December 28th at 12 p.m. We need to get the money collected before it can be paid and recorded. Anything submitted and finalized after that could be subject to an additional fee. Once again, anything that's held up and not processed by that date and time slows down our ability to even start the filing process. For those of you who are typically late or find things that need to be corrected, anything sent to Prestige after Friday, January 8th, it will require that a W-2C be issued to your employees, and there definitely will be a late processing and filing fee for the W-2Cs that are issued. So please, one thing that will come up in a later slide, and I'll mention it here because it really has to do with this, please have your employees log in through the portal, take a look at their pay stubs. I know personally, I look at the first one at the beginning of the year, maybe. And then I go all year long and I don't look at it and I don't verify that the right taxes are being withheld and that everything's been reported correctly. Maybe there's a different state listed. We have telecommuters. There are so many different circumstances that each and every one of our 16,000 worksite employees has. So please, and this is good advice for anybody, check your pay stubs before the year ends so that any corrections that need to be put in place are put in before the end of the year and are reflected on your W-2 that is then issued. Moving on to the next slide. Bonus information, please include that with your regular payroll regardless of the check date. Once again, we're just trying to get all of our ducks in a row and make sure everything is queued up and ready to go. December 31st is a big day, and a lot of payments are done, and January 1st is a Friday this year, which means that pay cycle is going to get bumped into 2020 instead of 2021. So please plan ahead. It will make things easier for you. Your employees will have all of the proper information on their 2019 W-2, and we will be able to process those payrolls, pull the money from the clients to cover it, and all of those necessary things. So please, try to start planning ahead on that. Now, moving to the next slide, there are adjustments and fringe benefits that need to be included in the compensation reported on the W-2s, specifically for owners, but there could be some officers that are including the personal use of their company vehicles. That is a taxable fringe benefit when you have a company vehicle and you put personal miles on it. The taxable value of benefits paid to S Corp owners. Now, these will be items that are paid outside of PrestigePEO. If you have an outside medical plan or some other type of benefit that you're paying for your officers or your owners in an S Corp that aren't processed through our system. Anything that is done, if you have an S Corp and your owners are all correctly marked in PrestigePEO, that addition will be done automatically by us. But there are things that you're paying your owners that need to be reported outside of our system. So please plan ahead and start letting us know now what those amounts are. And another big one that occurs is the fringe benefit of employer-paid life insurance for anything over $50,000. If you as the business is carrying an outside policy that we don't know about, please let us know the amount so that that taxable compensation can be added to the W-2. On the next slide, once again, as I talk about in terms of looking at your pay stubs and all of the information in the system, whether it's PrestigePEO or if we have some outside listeners, this is good for your employees to do as a business. Take a look at the personal information as the names and addresses that things are going to be mailed to. You can also sign up for an electronic W-2. Then you don't need to worry about it coming through the U.S. Postal Service, which is can be a slow process around the holidays. Your employees will be able to directly download it from the PrestigePEO system. And I also like it because I tend to misplace paper things that come in the mail, and knowing that I can just log into my portal and download my W-2 makes things a lot easier and smoother. And then on the last slide, if you've had terminated employees, please take a list and verify all of that information, especially since there have been a number of people due to the pandemic that have been on a leave of absence, possibly a quite extended leave of absence, just to make sure that everything is listed correctly in the system and we're going into 2021 with a correct employee status. So really just take some time in the next week to review that information in PrestigePEO and remind your employees, especially if this is your first year as a member of the Prestige family, please, again, have your employees check their pay stubs just to make sure everything is correct so that when they do file their taxes, possibly as late as April, there are no surprises for them. And Jason, that wraps up my part of the presentation.
Thank you, Carol. As always, I appreciate your involvement. Carol and I could do this all day. We could go back and forth and talk in these webinars. But unfortunately, we only have 3 more slides to go over for everybody here today. And they are important ones. You know, we do want to go over some compliance issues, or I shouldn't say issues, but some compliance reminders as it pertains to the end of the year and what that means for certain things like sexual harassment and paid sick leave and stay-at-home orders, as I mentioned earlier on when I was going through the agenda. So let me take you through some of these upcoming deadlines, right? So due to the COVID pandemic, luckily, the federal and state governments have been working with businesses on the deadlines that are typically imposed for various things. One of the areas that has taken the country by storm, state by state, is sexual harassment training requirements. I'm sure everybody on this call has seen this grow over the past few years, and rightfully so, with good reason. So let's start off with Connecticut. Connecticut's Time's Up Act requires the CHRO, which is the Commission on Human Rights and Opportunities in Connecticut. So the Time's Up Act requires the CHRO to develop an online training and education video and to make that available to employers at no additional cost or no cost at all. Under normal circumstances, the Act requires employers of any size to provide sexual harassment training to supervisors by the October 1st deadline, or within 6 months of their assumption of supervisory duties. Now, employers with a minimum of 3 employees must provide the training to all other employees, not only supervisors, also by the October 1st deadline, or within 6 months of that hire. However, due to the effects that the COVID pandemic has had on businesses within Connecticut, the governor, Ned Lamont, did sign an executive order extending the deadline to February 9th of 2021. So it's important to understand that this is a blanket extension. It does not require a request to be made, so it applies to everything. I've also included a link at the bottom of that Connecticut section that would take you right to the Commission on Human Rights and Opportunities link and page, so you can view it in further detail. Moving along to the state of Illinois, the state of Illinois, conversely, has not extended the date that businesses are required to have the sexual harassment training completed by. The Illinois Department of Human Rights created the Workplace Transparency Act in 2019 for these purposes of sexual harassment. This requires employers to train employees on sexual harassment prevention by December 31st, 2020. And then again on an annual basis thereafter. This requirement has not changed. It applies to all employers. It applies to all employees working in the state. And as I mentioned, it must be conducted by December 31st, and there are no extensions due to COVID. Again, at the bottom of this Illinois sexual bullet points, there is a link to the Workplace Transparency Act, the page within the Illinois Department of Human Rights. So if you did want to see further details or learn a little bit more about the Illinois sexual harassment training requirements, you may click on that link and it'll take you through everything. Moving along, another couple states we have here is Colorado and Massachusetts. Like with sexual harassment training, that more and more states have been requiring over the past few years, the same can be said for paid sick leave requirements. And employees or employers in New York know this all too much. On July 14th of 2020, so just a short while ago, the Colorado governor signed a bill known as the Healthy Families and Workplaces Act into law. This law is an overhaul of the existing Colorado's paid sick leave statutes, and it requires employers to provide paid sick leave to employees under various circumstances. In addition to addressing the In addition to addressing the general paid sick leave, the Act also expands the coronavirus disease 2019 specific paid sick leave within that state. And we're seeing this more and more with states that put together a specific paid sick leave for COVID, then they develop a more robust paid sick leave with more details, and then they kind of merge them together. And it's good that we're still thinking about how to protect employees within this situation on a state-by-state basis. Now, specifically, the Act requires all employees through December 31st of this year, 2020, regardless of their size, to provide each of their employees with paid sick leave for reasons related to COVID-19 in the amounts and for the purposes specified in the Federal Emergency Paid Sick Leave Act in the FFCRA. The employer size requirements are a little bit confusing, so I want to take just a second here to explain what those requirements are, but not necessarily why they were set up that way, because we're unsure why they were set up that way. So in 2020, all employers are required, in Colorado, all employers are required to provide the paid sick leave. In 2021, only employers with 16 or more employees are required to do so. And then we move into 2022, and again, all employers are required to offer it, regardless of the number of employees. So I'm not quite sure why they flip-flop from one to the other. Maybe it's that they just wanted to offer it to everybody this year and then go through a gradual upgrade from smaller businesses up to, any size. But that's the rules that they put in place, and I just wanted to explain that to everybody here today. So for the purposes of 2021, though, and I wanted to really focus on that, beginning on January 1st, the employers with 16 or more employees are required to provide up to a maximum of 48 hours of paid sick leave for every 30 hours worked. And that accrual method seems to be the standard for the most part across the nation. Certainly here in New York and other states that we're seeing, 1 hour for every 30 hours of work seems to be the norm. So at least we're being a bit consistent on a state-by-state basis from that perspective as well. Even in the 40 to 48 total range, that seems to be the norm. So let's move on to Massachusetts before we get to our last slide after this. Let's discuss the Paid Family and Medical Leave Act available through the state of Massachusetts. So the Massachusetts PFML, which was first established in June of 2018, this Leave Act allows employees to begin taking the leave effective on January 1st of this year. So just in a few short weeks, Massachusetts employees will be eligible to take this leave. Now, most workers in Massachusetts will be eligible to get up to the 12 weeks of paid family leave and up to 20 weeks of paid medical leave. The program is funded by premiums paid by employees, employers, and the self-employed. Now, one thing to note here is that starting on December 2nd of this year, 2020, eligible Massachusetts employees may request to have may request leave to bond with a child on or after January 1st. And then starting January 1st, eligible Massachusetts employees may begin to request leave for other purposes. So right now, the request to leave for Massachusetts employees is just for bonding with the child. Beginning January 1st, it's for every other reason. Moving on to our last slide for today's webinar is really just an update on California's recent stay-at-home order. And this is a very recent stay-at-home order. On December 3rd, California Governor Gavin Newsom announced a regional stay-at-home order that could have a dramatic impact on the businesses within the state. So unlike previous orders, the regional stay-at-home order really focuses on shutting down regions, not counties. And this is based on hospital capacity in each of those areas. So the order went into effect at 1 p.m. on December 5th for any specific region when ICU capacity for hospitals in the region drops below 15%. Now, the order is not currently in effect in any regions. However, the governor does predict that the Bay Area will likely fall under the order by mid-December, which we are quickly approaching. The other regions will likely to hit the 15% threshold by early December. So the California Department of Public Health will identify any regions that hit the 15% threshold. Once a region falls under the order, businesses will have 24 hours to comply with the restrictions. Now, once the order is triggered in a region, the restrictions will go into effect within 24 hours and will last for at least 3 weeks. The restrictions in the region will continue until the CDPH's 4-week projections of available ICU bed capacity is at least 15%. So it's important that if you are a business in California, if you operate in California, if you have employees in California, you could be impacted by this order. It is vast. There are a lot of details to it, but we understand why it's been put in place. You want to make sure to quickly understand and address that, and this is something that we can help you out with here. So that is really the compliance reminders. As I mentioned, we could spend all day here going state by state, county by county, providing you with everything that you need to know. I'm sure there's better use of your time. As much as I'd like to talk to everybody here, if you do have questions, please reach out to your support staff, your HR business partner here at Prestige, and we can certainly help walk you through any questions you might have or any plans that you're looking to put in place. Beyond that, we here at Prestige are going to continue to put together our communications that everybody here receives, our Insights newsletter, any type of compliance updates, and anything that you would need to know as it pertains to not just COVID-19 and pandemic related, but everything else, paid sick leave, other types of regulations. This is what we spend our time on helping to put together for everybody, and we're going to get that information out to you as it comes into us. So thank you again, everybody, for hopping on and spending a little bit of your morning with us today during our webinar. I hope everybody has a fantastic rest of the week and looking forward to speaking with everybody again soon. Take care.